Far fewer Americans will have health care coverage through the Affordable Care Act this year as millions faced soaring coverage costs for 2026. Congress failed to extend enhanced tax credits in December, resulting in millions of Americans facing higher premiums. The nonpartisan Congressional Budget Office estimates 4 million people will eventually lose their insurance without the extension of the credits. CBS News medical contributor Dr. Céline Gounder joins us now. She's also an editor-at-large for public health for KFF News. So, Doctor, what is your takeaway from this enrollment dip? And if, in fact, Congress does vote to extend these subsidies, which there's no indication that they will right now, are the people who didn't sign up because they couldn't afford it just SOL?
Well, that remains to be seen, and the numbers right now are incomplete. So you have some people who are being automatically renewed. They may be waiting to see what the bill is and whether they can really afford it before deciding to pay and formally continue. So the numbers may actually be even lower than what we're seeing now. But then if the subsidies are extended, that will also factor into that decision making. And some people may decide that they do want to be insured.
And so at the same time, President Trump, he's promoting what he calls the great health care plan. What stands out to you about that?
Well, he's talking about drug prices, making some medications over the counter. That may make it easier to access medications, but at the same time, will those medications still be covered by insurance? He's also talking about price transparency. This is something President Trump also championed during his first term. But that price transparency hasn't actually made it easier for a lot of people to navigate what something's going to cost them. And so there's still obviously more that needs to be done on that front. Big picture, why are healthcare costs in the United States so high? Why are they so much higher than other high-income countries? And the biggest drivers are actually not prescription drugs. Rather, it's the cost of inpatient care, so hospitals, and outpatient care, so when you see your doctor in the office. And those costs remain much higher than for other countries. And there's nothing, at least in what's been sketched out. We don't have the details of the plan, but at least in the sketch that we received, that we got information about earlier this week, there's really nothing in there that explains how to bring down those costs.
Okay, Dr. Céline Gounder, we appreciate you. Thank you.